From the campus of the University of Kentucky, you're listening to Behind the Blue. I'm Cody Kaiser with UK Strategic Communications.
We have, in healthcare and healthcare policy, long been aware that acute care providers, hospitals, physician offices are paid by volume, by seeing a patient, and very few times are we paid to make an individual healthier. But the university is well positioned to take on that challenge. But you have to do that with partnerships, and you have to do that in each community, listening to your community partners on how you do things, like our many years of work in smoking cessation, cancer screenings, physical activity. And ultimately, if we're degreeing more Kentuckians at the university, either here or with partners, and those individuals are staying in Kentucky, you're driving a healthier economy for the state, which is the number one indicator of health outcomes.
That's Rob Edwards, UK Healthcare's Chief Strategy and Growth Officer. For years, the University of Kentucky has worked to close the health gap for Kentuckians through research, outreach, and deep partnerships across the Commonwealth. But with a new initiative, the Advancing Kentucky Together Network, UK is building on that legacy in a bold new way. It's not just about healthcare. It's about improving lives across the board, from education and employment to local economies and well-being, through a network of community partners, healthcare systems, and university experts all working in sync. On this episode of Behind the Blue, Edwards and UK Chief Communications Officer Jay Blanton join me to talk about how this new university-wide effort evolved from decades of partnership building, and how UK is aiming to meet one of the most ambitious goals any public university has set: to do more than anyone in the country to improve the health of its state. Rob Edwards, thank you so much for sitting down to talk with us. I want to kind of jump right into things. Can you briefly explain, in kind of a bigger overview for people who are listening who may not know, what the Advancing Kentucky Together Network is and what prompted its creation?
Thank you, Cody, and appreciate the question, the time, and the thought about how the university and all parts of the university come together to try to improve the health, wealth, and wisdom of the Commonwealth overall. And it ties into the university's long history in leaning into our Commonwealth and into our land grant engagement strategy. But very specifically, the Advancing Kentucky Network builds upon years of work we've done on the healthcare side in building networks of healthcare providers in working together to improve clinical care for patients and to provide that care close to the patient's home and as much care as possible close to the patient's home. We probably have 400 or so initiatives where we partner with healthcare partners in all parts of the state to provide that care closer to home. And the next iteration was really an initiative that pushed us from the Board of Trustees in October of 2024, where they asked us to specifically begin university-wide initiatives to improve health, support local economies in their growth, and to improve the workforce of our healthcare systems around the Commonwealth.
And in many ways, I kind of take from this, we've talked for a long, long time, 20 plus years, about health disparities in the Commonwealth and what the university can do to help address those through healthcare, through research. This just seems kind of along that path of a continuing evolution of how we best address these issues and move forward, correct?
There's no doubt the Advancing Kentucky Network is an evolution of all the work. And I'll give you a great example. The Markey Cancer Center, our NCI-designated comprehensive cancer center, for years has had a statewide network to help hospitals around the state improve outcomes for patients who've been diagnosed with cancer. In the last 3 years, they've been specifically working around the state to improve lung CT screening to identify lung cancer earlier in patients and before it metastasizes. And they've literally seen improvements in diagnoses from, say, stage 4 to stage 2 so identification of that cancer earlier, and hospitals, 40 hospitals around the state working on that effort together has led to earlier identifications of cancers and better outcomes for patients. So then if you extend that concept university-wide, partnering with the College of Agriculture, Food, and the Environment and their extension agents in all 120 counties, partnered with clinical partners, partnered with local health departments, what can we do to continue to move the health indices of individuals in our state?
So when we talk about health and this directive from the board and this initiative, we really are using kind of a really broad, holistic kind of definition of health that moves beyond what you might traditionally think of doctor-patient relationships or clinics or hospitals, things like that. We're branching into a lot of different areas that UK has resources that can move forward and help with.
Yes, and we have, in healthcare and healthcare policy, long been aware that acute care providers, hospitals, physician offices are paid by volume, by seeing a patient, and very few times are we paid to make an individual healthier. But the university is well positioned to take on that challenge. But you have to do that with partnerships, and you have to do that in each community, listening to your community partners on how you do things, like our many years of work in smoking cessation, cancer screenings, physical activity. And ultimately, if we're degreeing more Kentuckians at the university, either here or with partners, and those individuals are staying in Kentucky, you're driving a healthier economy for the state, which is the number one indicator of health outcomes.
When we look at that kind of idea of where the kind of the board says we want the university to do more than anyone in the country to improve the health of its state, that's such an ambitious kind of charge. This all kind of filters into this. How do you measure that success? And is this like where do you go with that?
You have to do it with partners. There's no doubt about it. I'll give my friend Jay Blanton, who will speak, the credit for the hairy, audacious goals that the university often takes on. But in partnering with our College of Public Health specifically, where we have a great department of epidemiology, they're used to using publicly available data and other local community data to identify directionally where population's going from a health standpoint, and then analyzing how those data change over time based on specific initiatives. And so it'll be a lot of work in partnering with the College of Public Health, their partnerships with the State Department of Public Health, local health departments, great entities that collect data at the local level, like federally qualified health centers or rural health centers. I think it is, we have to go into each community and identify what initiatives are we going to take on, what types of demonstration projects might we provide in a community, and then how we track outcomes to show that we're making an investment that is returning better health, better economy, more degreed individuals, more people participating in the workforce. And all of those things will then feed back to acute care providers like UK Healthcare, because we have dramatic healthcare workforce needs.
And I think, Cody, too, that there's a recognition inherent here that is both old and new. The old is that, for 160 years since we were created to be about Kentucky. How do you advance the state? You've heard Dr. Capilouto's been on a number of times, talks about that a lot, that was the whole idea behind a land grant institution. These institutions are given grants of land, and in return for that, they were supposed to make their states better, largely through workforce, and that mission's just grown over time. That's the enduring part of all this. The new part is, I think in the last 4 or 5 years in particular, our board of trustees, who come from the state, they are by law designed, the people's representatives, have said, we really think Kentucky's at an inflection point, and we want to get more and more focused on what it means in a 21st century economy and facing the particular challenges that Kentucky faces. What does it mean to advance the state now? What does that land grant mission mean today? And so for the last 4 or 5 years, I think they've been moving forward, looking at the state's challenges, looking at what our mission is, and saying, all right, how does mission meet moment? How does the University of Kentucky really, at this opportune, critical time for Kentucky, how do we really move the state forward? Because there's lots of great things going on in Kentucky right now. We've had billions of dollars in economic development investment in the last 4 or 5 years alone. Whole new sort of, evolution of what were niches in our economy. So auto manufacturing, Kentucky's long been one of the top 4 or 5 auto manufacturers in the country. Now we've got this whole investment going on in electric vehicles. Bourbon industry's big. Healthcare industry is growing for both good and challenging reasons. But lots of areas of our economy are really growing at the same time that meets headlong into these challenges. Health, as Rob indicated, continues to be a huge challenge. While because of places like Markey and working with partners, we're seeing some good things in cancer in terms of screening rates, and some cancers actually going down in terms of incidence rates. We still lead the country, right? And the amount of cancer that our state faces, we're still among the top states in the country, unfortunately, around opioid use, misuse, and addiction. Still have huge issues around cardiovascular disease and aging-related illnesses and maladies. So those are where these great opportunities could be thwarted by these challenges. And so I think our board has said, as a university, and to Rob's point, we've got to think about the overall health of the state and what that means. So it's not only treatment of disease, but preventing it in the first place. It's not only retaining and graduating more students, but it's retaining and graduating more students who are ready for the specific jobs that are growing in our state. So how do we look at what's happening in the state in terms of the job growth and map what we do out there with those great faculty, educationally map those things to those careers? It's how do we be seen? We've got this great history through healthcare and extension in particular of partnering with people. We know a lot. We got a lot of experts, but we don't know everything. We don't have every answer. People in community tend to know what's going on in their communities better than we do. What we can bring to the table is specific expertise guided by people in communities to help with problems. So how do we leverage the fact that we, outside of state government, are the only institution that literally has a presence in every county in the state? What do you do with that? How do you leverage that and partner with people to solve challenges? So our board, to your question, Cody, has really gotten around this idea of, at this particular moment in time with these challenges and with these opportunities, can we be the institution that partners with people to do more to improve the health of our state, the holistic health, to your point, than any other institution in the country? And that's really what we're trying to get around to. And we really think, and Rob can explain this much more deeply and better precisely than I can, that a sort of approach of a network where we formally and sometimes informally, but formally affiliate with partners in different domains, whether it's education, workforce, healthcare, you name it, because we've got it here. How do we partner with those experts and communities and, guided by them, solve challenges, advance opportunity, and create more opportunity?
I kind of want to unpack a little bit of that in talking about, scaling up what we're doing in a sense, because we've got this background with the healthcare network. Eric Monday has talked before about there have been needs and we have been uniquely positioned to respond to needs. And so kind of this thought of if not us, who we'd like to be a part of helping address certain things. This idea of kind of expanding from not just clinical affiliates, but looking at kind of a bigger overall view of the state, educational institutions, and other parts of communities. Am I right in assuming that we're kind of taking the model that we've done with healthcare, and then we're just kind of scaling it up in a certain degree and kind of shifting the kind of focus to this works in this, and now let's see how we can do in these other areas?
Cody, I agree. I think there's two pieces to that. One, we're humble in looking at the challenges of the state and knowing that we could never move health indices, for example, on our own. And we've always done that with partners. The geography of Kentucky, especially in tackling health, public health, education, it is so broad. You are almost, you need that network effect in order to tackle any new initiative around health, education, economic development, and we do approach this audacious challenge from that humble soul, if you will, of the university. And so I do think we have learned from our UK Healthcare Affiliate Network, but we're not the only ones who've built networks at the university or in state government or corporations in the state who've been headquartered here, who've invested in the success of the Commonwealth. But I think that it is maybe a little more unique to states like Kentucky to say public entities, private corporations, not-for-profit entities uniquely here come together in a way to tackle a great challenge. Recently, the floods in London, you can see how aggressively folks from all corners react to that type of crisis in our state and come together to respond. Same with floods in eastern Kentucky. So I think it is a little bit of learned behavior, but also a recognition that the university on its own can only do so much. But we are good and have strong experience in facilitating groups from all different types of backgrounds in order to try to achieve a certain goal. And that's what we're setting out to do with the Advancing Kentucky Together Network.
In looking at the healthcare partnerships, and specifically talking about Pikeville Medical Center, what does their inclusion mean for Eastern Kentucky?
I'd even broaden it further. We have great partnerships and long-time relationships with Appalachian Regional Healthcare, Pikeville Medical Center, a lot of the federally qualified health systems, centers in Eastern Kentucky, like Primary Care Centers of Eastern Kentucky, like Mountain Comp, FQHC, and then, of course, more recently in Northeastern Kentucky, King's Daughters and St. Clair have joined our family. And so I think now we have a true built environment, if you will, where if we went to tackle lung cancer screening, we could do that together and on the same clinical protocols based on standard evidence. And so I would say we're taking a lot of long-time relationships that are built on trust because we've delivered on things like helping provide. We have this great program called Kentucky Angels, and sonographers go around in Eastern Kentucky with OBGYN practices and ultrasound high-risk moms to help the local OBGYN determine if that patient can safely deliver in their community hospital or if they might need to come here for a high-risk delivery and then return back home. And the outcomes from programs like that are so tremendous. And we know that we don't have unlimited capital here. And so we've been able to find a model that works from both an expense standpoint and a health outcome standpoint. I would say that the corner of the Advancing Kentucky Network that is most mature, though, to your point, is in relationships with Pikeville Medical Center, Appalachian Regional Healthcare, our community health partners in those communities, and only added to by the work of the College of Agriculture, Food, and the Environment in their Food is Health initiatives.
And then looking at the academic side of the network and that collaboration, let's talk a little bit about the partnership with Transylvania University and give me an idea of how students will benefit from this and kind of maybe what's in early development of the direction that we go with this.
I can start and certainly Rob will join in. So Transy is this really wonderful, interesting, historic liberal arts college right next door to us as our neighbor, right? They're older than we are. It's a just terrific institution. But they have been thinking, I think, and pondering under their leadership. They've got fairly new leadership in their president, Brian Lewis. They've been thinking about how do we grow? How do we be more responsive to what we see students wanting to do in terms of careers? And how do we partner? And I think they look at us, sometimes we talk about colleges and universities competing with each other. I think they see us as a partner and we see them as a partner, that we can both be better together than we can be apart. And so the idea, I think, for them is, one, they're leaning into where they are in Lexington as an institution and selling Lexington, which is a great community for a student to come and spend a number of years as a student. And then I think they want to lean into their partnership with us in a couple of particular ways. One, Students might want to come to Transy and still have that small liberal arts undergraduate experience, and with the particular attributes that Transy has in a metropolitan area. But they might be thinking, but I want to go and have a graduate experience because I want to go into public health or medicine or nursing, and do that with a graduate level. So what Transy's doing, one of the initial partnerships we're thinking about is sort of what we call, with the academic types, call a 4+1 program with public health, where you would come in, do your undergraduate work at Transy, but with the understanding that you'll matriculate right away into a master's degree in public health, which is a growing field. We have an incredible college with a really innovative and entrepreneurial dean in Heather Bush. So thinking about how that becomes an automatic process. And so they can sell that to students as they're recruiting students who health is a growing, as we talked about earlier, is this incredible growing field in the Commonwealth, and areas like public health in particular are growing, and there's great need there as well. So a student might want to come to Transy knowing that, hey, I'm going to have my 4-year experience here because that's the experience, the particular student experience I want at a great place like Transy. But then, no, I'll go automatically into that graduate program at the University of Kentucky with a great public health degree. And we can think about that in other health programs. And that's going to benefit Transy, but also benefits us as we think about, and Rob knows more about this in more detail than I do. We have huge health workforce needs in areas like nursing, but virtually every area you can talk about, professional area you can talk about at UK Healthcare alone, we need thousands more people to join that healthcare workforce over the next several years. So having partners like Transy, we know are going to send us great students who are interested in health. It really is one of those win-win, mutually beneficial kinds of partnerships. But that's just one domain we're looking at. It's everything from the relatively small, like giving them greater access to our library archives as they approach their 250th anniversary. They're coming along right after Lexington, to things like this public health degree program and other health degree programs.
And then trying to find ways where we might share back office resources. And so they've asked lots of questions around student retention, employee retention, how we might share faculty when possible, especially in some of the subspecialty areas, and just having both of us in the same community and be able to have those conversations has been really exciting, and I think a great way for both of us to embrace Lexington and the 250th anniversary and say we're locking arms and doing this together.
You know, I think about the public health aspect of it, and we just recently interviewed a couple of graduating students from the College of Public Health. They talked about their specific interests and what led them there, as opposed to being more in the clinical side of medicine, the idea of helping more people, like a larger population, through what they can do in public health. But just that kind of, I know we've kind of been focused in and looking and anticipating, we expect to need like 5,000 new healthcare professionals over the next decade. And I feel like this really does kind of help build that framework in order to help meet that demand, because we're talking about so many different areas of healthcare, from the administrative side of things and not just the clinical side, but all of those different areas. It really does kind of feel like that this is kind of really helping to shape that up.
You hit on two critical aspects of what we're hoping to do with the network with educational partners. One is, and I'm an example of this, my freshman year in college, I had no idea all of the different healthcare professions that were available to me when I graduated. And so some is just general exposure to all of these opportunities on the more traditional healthcare side, clinical care side, but we cannot invest in that side to the detriment of our traditional public health activities that are rooted in the science of behavioral health, in epidemiology, all the things that I'm sure Dean Bush could come in and talk to much better than Jay and myself. But we need an investment in workforce on both sides, because a healthier population overall is going to reduce expenditures to the state from a Medicaid standpoint, to employers who fund a tremendous amount of health care in our Commonwealth, and we know that that will strengthen our economy.
I think about the Martin Gatton College of Agriculture, Food, and Environment as well, and the real growth and innovation and creativity that they've had, and some of the areas that they've kind of the things that they're focusing on in order to influence economic growth and vitality. And that all goes into that idea of a broader well-being for Kentucky communities as well.
Cafe is a great example. I mean, we talk about partners, but then there's also just the work that we do as an institution. So in Cafe, you have a professor who has a background in nursing, is her training, has worked in public health, but is now in ag, and is working on a project that we call Food is Health, where she's working with insurance companies and other providers to actually screen people, and I think you've talked to Dr. Christopherson before, screening people for a propensity to or proclivity towards, say, diabetes, and then getting them on a meal program with, kind of packaged meals or meal plans that will help address that issue. And so then we can sit there and measure the progress, and we get into not just then the treatment of disease, but preventing the onset of it in the first place. Well, that's happening out of an agriculture college where they're combining food, health, treatment, prevention, all in one place. And then Rob's team over at UK Healthcare has used informed by data, thinking about where we're going to place an acute care clinic, an outreach health clinic in Fayette County, and looking at the data, looking at measures of health and what's happening in Fayette County, saw that there's one zip code, 40508, really in the shadow of this institution, where the life expectancy, there's a 10-year gap between the life expectancy in that zip code and the adjoining zip code, which is a remarkable statistic to think about, not in a good way. But you have a clinic there, and it's not just going to be a clinic that over the next year that Rob and his team are going to lead and develop. It's not just going to be a clinic that treats people. It's going to do that. But people may come in and think about food needs and nutrition needs. That clinic's going to be right near the public health department. It's going to be right near Transy, too. What if we were able to bring in the expertise that we have to bear in those places to think about the overall health, big word like the board wants, holistic health, needs of that entire zip code, that entire community, to sort of try to raise that up. And then when you do that, can you then replicate that? Can you scale that? Can you take that to other places? That's what's really exciting about that. I mean, one of the things that, and we were in a conversation with some folks the other day talking about that clinic that was amazing to me. You learn pretty quickly that about things like the transportation challenges that people have. So someone in that zip code may not be able to bring their child to a clinic visit at 2 p.m. because they have to work. So you might have to have a clinic that thinks about things in different hours. Well, that's the kind of creative thinking that you do with partners who are on the ground there. But then when you're thinking about health in that kind of holistic sense, they could inform by data that we can bring to the table because of who we are as an institution, and then partner with people. That's what's really exciting about this kind of network, to really think about what does health mean writ large, and how do you address that in particular and specific places. And then you can think about how do you scale it, how do you replicate it, how do you take it to a broader community. That's something that we can do, not alone, but with partners, but that we can kind of uniquely do.
And create experiences for our students, for Transylvania University students, for Bluegrass Community and Technical College students, to participate in that experiential way, where they take that on and they pass that to their broader network, their broader social network.
I can also see this kind of creates a potential for, when you're doing that kind of outreach in the community, creates opportunities for outreach in the public schools, not just in Lexington, but in all the communities in Kentucky, to kind of help kind of foster that kind of attitude and approach towards, how do I look at my own community? What I see that this is happening here, this is inspired. I want to go to school to do that. I want to be the next in line to be a part of this. When we kind of look at our first steps into this, and as we kind of develop this network out, can we talk a little bit about what kind of initially, and I know that it's kind of we don't have a lot of answers maybe initially at this, but resource-wise, as far as financial, human, technological, what do we look at as a university in investing to support this kind of network?
I think we're still talking about a lot of that, Cody. This is in sort of the infant stages, and lots to do, and it is a little bit of flying the plane while you're building it, which is fine. That's sometimes it's just the way things get done. But I think there are 2 or 3 buckets of ways we're thinking about this, and then we'll think about resource allocation along with that. That one, there's who are folks that we want to seek out as partners and that who want to come to us, and both things are happening. We've had folks who are coming to us, not quite ready to announce yet, who are saying, hey, we want to partner with you about this specific need or this specific issue, or we think we could help you with this, that kind of thing. So, and then we've obviously got the partners we've already talked about, like Transient, Pikeville Medical, and others. So there's partners. And then I think there's what we call demonstration projects. I mentioned the Food is Health, I mentioned the clinic in Fayette County. There's some others where we think they are projects that we could be doing in specific communities and counties. We might already be doing them. We might be thinking about what we could do given the great expertise we have with faculty and staff, sort of projects that we could go into community and really address a specific set of issues with our subject matter experts, our faculty, our staff, partnering with people like whether it's local government, local health department, extension office, what have you. And then you can think about measuring how well they work, and then can you scale them up and think about taking them more broadly. And then there are things we're just already doing that, not to be crass, it's just a matter of branding it. This really ought to be part of this network, and we ought to be promoting it that way. There's, as you well know, you talk to lots of people through the podcast and others, there's just lots of great faculty and staff and students doing just fantastic stuff throughout the state where they really are in service to the state. I think one of the things that makes UK unique beyond capacity is commitment. This really is a place where I think when you go out, not to be Pollyannish about it, but when you go out and talk to people on our campus, students, faculty, and staff, there really is a deep and I think shared commitment to the state. I think there's a real understanding that doesn't exist at every institution. Not every institution's like what we're supposed to be anyway. But there's a real commitment at this place to being about the place, to being about Kentucky. I think there's an understanding of what the mission is at this institution. And so I think there's lots of things already going on to that point that ought to be part of the network, ought to be labeled as such and promoted. So we're thinking about it that way. So there's some resources that already be expended that are part of the network, some resources we have yet to determine. And so we'll be working on that sort of iteratively, I think, as we move forward.
Well, kind of talking to that, and we talked early on about the board and the board being of Kentucky. They've got vested interests and roots and things that tie them to this state in deep ways. Our community engagement, the communities that we're involved in, I'm kind of wondering on that side of it. Have we already started to hear, what are some things you can tell me as far as the community buy-in, as far as these relationships that not just the board, but just every aspect of the university, from research to healthcare, that has had a relationship there? Have we been hearing back from this, we're on the right track with this is what we need?
I think, Cody, yes. And to also go back to your other question, I do think already there are some real university resources being applied. So Trudy Matthews, a great healthcare policy leader at the university who spent her career thinking about better health and better healthcare systems, recently came with the dean of the Martin Gatton College of Agriculture, Food, and the Environment and presented how UK Healthcare and the college are going to jointly provide funding for 4 specific demonstration projects over the next 3 years, all approved, for new resources for several communities. I don't want to get ahead of their announcement. I'll let them come and be on your podcast. But there are several communities already that have reached out and that they have begun discussions with. Again, we need to come into those discussions from a very humble place. It has to be the community saying, this is a great discussion about identifying cancer earlier in patients, but we really need you to reach out to our faith-based community, to these existing community partners who've been really just looking for that extra spark and building that on-the-ground infrastructure that we could never provide on our own. But we can facilitate those discussions and then track outcomes so that if we can achieve something in Perry County or Greenup County at a distance, that's a model that we could take throughout the state, or for that matter, throughout the world.
It really was, I think, in part, one of the things the board saw and one of the things we learned, frankly, in COVID. I think we saw up close how important partnerships were, but how important partnerships were in the context, too, of extending our capacity and our commitment. Not just the vaccination clinic at Kroger, which you saw up close, but over the course of several weeks, the institution did mobile clinics, largely in churches, and that was really all about partnering with faith leaders who said, "Yeah, you can use our gym. We'll help sign people up." The state's health department, was involved in that too, obviously with the vaccines. Our police department was involved. Medical students were there on the ground, nursing students supervised by faculty to administer the shots. I mean, it really was an example of that wasn't directly connected, obviously, to the network, but I think our board saw that. I think we saw that, hey, partnerships become this kind of force multiplier for how you not only, I think, be humble about what you bring to the table and how you support people, but also just in terms of what can really extend the capacity of the institution. We are uniquely positioned in a lot of ways to do a lot of things, but when we do it in partnership with others and when we listen to people and we're humble about it, as Rob has said a couple of times, there's not a lot of limit to what the state can do. And I think that was a real example, I think, an eye-opener that our board saw up close and learned about, that we saw up close and learned about, and has really, I think, helped coming out of COVID even focused our efforts even more. We've got a strategic plan that's 4 or 5 years old now that really is all about advancing Kentucky. And over each of the next 3 or 4 years, the board has kept sort of up in the ante and saying, all right, yes, you're about advancing the state. We see your graduation rates going up. That's great. We see you treating more patients. That's fantastic. What's the next thing? What's the next step? What are the state's challenges, to your point about these are people from Kentucky who are leaders in their communities, who come in and say, all right, we see this as the real challenge. This is the real nub of the problem. What do you do next to advance the state? And that's where we've arrived at this point a few months ago of this challenge in this direction to say advance the whole health of the state, but do it in partnership with people.
As we wrap things up in our conversation, and I realize we're really only scratching the surface of a lot of this, what are some next, I guess maybe in a big sense, do we have an idea of what next steps are? And also, what do we want listeners who hear this to understand about this effort and why it matters to them and their families and their communities?
And I'll take the first part. The next steps are clear. We need to formalize our relationships with key partners in all corners of the state. So clinical providers, other institutions of higher education, other educational institutions altogether, and then in the other corporate not-for-profit world, who wants to partner on improving health and lock arms together. And we need to formalize those relationships because by creating contracts around these things, you create momentum. And we have to keep this momentum going. The board's charged us. I'm certain the board will ask for a report on how we are doing and how we are improving health, wealth, and wisdom in our Commonwealth.
Yeah, I think that's exactly right. I think it's a really interesting question that we're wrestling with, this idea of in two ways. One, we're a really big place, 36,000 students, 26,000 employees, growing, which is good. That's good for Kentucky. Bringing together a place of this size and this scope and this scale around one question, how do you improve the overall health of a state, is an interesting, not just a communications issue, but it's an interesting policy issue. It's an interesting manpower and logistics issue. How do you really do that? And I think it's the right question, and I think we're searching for the right answer. I think the other thing that's interesting about it is at the risk of not being humble, I don't think you would typically think of a university saying, this is what this university is going to be about. We think of our mission, right, as education, research, service, and care, and they are. But what if you turned all the pillars of that mission in service to that commitment and that principle? That's different. I don't think you have a lot of universities talking that way. But I think we would say, going back to that question that was asked 160 years ago, of if you're going to be committed to making Kentucky better in whatever way that means, how do you do that today? What does it mean today? And what we've decided, what our board believes and has directed us to do, is today what that means is if the state's going to move forward, it's got to move forward in this kind of question of overall health. And that's the commitment. And I'm not sure there's another institution that is thinking about its mission, another higher education institution, thinking about its mission in that very specific way. And how do you bring all that we are to the table to do that?
That is a lot to unpack and a lot to look forward to and look at. I appreciate the time that both of you have taken to talk about it. Rob Edwards, Jay Blanton, thank you so much. Appreciate it. And I know that we will more than likely circle back and have another conversation about this in some way in the near future.
Thank you, Cody.
Thanks for listening to Behind the Blue. Behind the Blue is a joint production of the University of Kentucky and UK Healthcare. For more stories about UK and UK Healthcare, visit uknow.uky.edu.